Okay, so what is Ask Graph? So priority, right? Our priority is Ask Graph. So this is a mnemonic I came up with as I was studying for boards, my boards, your boards, PA boards. I've taught them all at this point. So what is Ask Graph? Well, in reality, a lot of people think of what ABCs, airway, breathing, circulation, airway, breathing, circulation. But as you do board exams, as you start to see these patterns, as I start to see patterns, I started to see a lot more specific subjects that I was freaking out about, or priority, or as I like to call it, freaking out about questions. Because ultimately, airway, breathing, circulation is great. But if you look more specifically at what Ask Graph is, you're going to start to see things that are going to pop up at you that are a little bit more specific. And back in the day, it used to be just find me one of the 8. And then one day, peritonitis, I sat there and I was like, I've got to figure out a mnemonic for this. Airway is above all else sepsis, changes in potassium, glucose less than 70. When you're looking at pediatric patients, lethargy or grunting are going to be good descriptors that this child is in danger. Altered mental status, peritonitis, and hemorrhage. Now, I go into these in great detail when we cover the course. And those of you that have watched on YouTube, podcasts, it's all there. It's everywhere. Ask Graph is everywhere. It's a quick tip. And these are the things that you're looking for. So airway, breathing, circulation, fine. But how about something more specific like sepsis or changes in potassium, glucose less than 70, which they will give you glucose less than 70, lethargy, grunting, altered mental status like seizures or disorientation, confusion, psychosis, peritonitis, right? That rebounding, that guarding, that rigidity. How about hemorrhage, that low blood pressure or that tachycardia, right? Look at these more specifically now. The priority questions that come up that say first, initial priority, urgent, most concerning, immediate, report to HCP. Those are the ones that we're freaking out about. Those are the ones that we're freaking out about. Ask Graph. But what if somebody has a priority question and they're post-op, post-procedure? We took this and I made it a little bit more narrow. Good. Those of you that have been with me or been in the course, you will notice that then I took it and narrowed it down from 8 to 4, because post-op, post-procedure, pre-procedure, we're looking at a few things. We're looking at airway. Well, we've sedated them, right? Maybe they're on painkillers, something that's going to decrease respiratory rate. We're going to look at altered mental status. What if they develop some sort of a seizure or a drug-drug interaction, right? And then lastly, or second to last, we got sepsis, because again, maybe they don't give you that this person has a fever, but what if they say this person has a blood pressure of 60/30 and purulent discharge? Sound a little fishy, sound a little scary? Yeah, because now they're telling you, hey, this person's got some sort of an infection. Can you logically deduce it? Are your critical thinking skills going to let you determine that this person may be septic? And the last one is hemorrhage. How about somebody that develops what's it called, or that goes through like a liver biopsy, a kidney biopsy, highly vascular organs, right? And now they come back and they're pale, they're diaphoretic, they're tachycardic. Whoa, what's going on here? Hemorrhage, right? So this is Ask Graph. This is ASH. And what is the mnemonic here? What is the saying here? Don't let your patients turn to ashes. So a good question that was posed, does this work in nursing school? Yeah, absolutely. Everything that we've encompassed, I've got so many nursing students that utilize our material just to help them get through their exit or their exams, their classes, final exams, whatever it is. None of this changes, right? Airway is going to be priority. Identifying sepsis, changes in potassium, glucose, these are all things that are going to present. And then in real life, because how many of my students that are emergency department or they're in the ICUs, whoa, tell me you're not going to see AskGraph or ASH, right? So very important. These are things that don't change throughout the course of teaching, right? Oh, Dr. Z, you're an MD. Why are you teaching nursing? Well, tell me how airway is different for us in general in medicine. It's the same. Tell me how diuretics are the same or different for us. They're not, right? These are all things we got to be able to identify and know how they work, right?